Do you know how to classify an orthopedic infection, the mors of an ilitis? My name is Mário Soares. I'm an orthopedist who specializes in orthopedic infections. I'm going to tell you how we classify it because it's important for us to know whether it's mild or severe when it comes to orthopedic infection. I'll just tell you a quick story. An American orthopedic surgeon created this classification he's considered to be, deceased, but he's considered to be one of the people who understood the most about orthopedic infection. And he studied for most of his life with a doctor who is the world reference in orthopedic tumors. He took the same concept that was used for tumors and passed it on to orthopedic infection, which is Professor Tierney. Tierney's classification takes into account two factors. Firstly, the involvement of the infection in the bone. And the second factor, the host, in this case, the patient, what the patient is like. Speaking of the bone, he divided it into 4 types. Type 1 is the infection that occurs inside the bone, inside the marrow, let's put it this way, in a very layman's way, right? In the medullary bone, not in that hard part, but in the softer part of the bone on the inside. It's usually related to infections when you put rods, a rod in the leg, a rod in the hay. A type 2 infection is one in which the bone has appeared. So the person has a problem with the skin, a wound or necrosed the skin opened and the bone was exposed, the bone stuck out. After a few days, usually around 3 days, that bone dies and osteomyelitis develops. It's just osteomyelitis of the outer layer. It's type 2 osteomyelitis. Type 3 and type 4 osteomyelitis, which I'm going to mention now, are the most common. Type 3 osteomyelitis is the kind that takes over all the layers of the bone and destroys them. What's the difference between it and type 4? In type 4, I have a loss of bone stability. In other words, I have a pseudoarthrosis. I have a bone that naturally the person won't be able to walk or move. In type 4, the bone there is still stable, it's still whole, the person still has their function. However, the bone has holes, the bone has dead areas. Type 4, if there's no metal holding it together, a plate, a rod, or a splint, whatever, the person has no function. This makes type 4 obviously the worst and the most complicated to treat. Now, the big thing, the big difference, the big leap, the most important part, the one that maybe people neglect a bit, but I'll say it again, it's the one that matters most. It's how the person, how the patient is. Professor Tierney divided Class A, Class B, and Class C patients into 3 types. Class A is the patient we call healthy, the patient who doesn't have any disease, who normally, because of a trauma, an open fracture, a motorcycle accident, or something else, has had an infection in the bone. But apart from the site of the infection, that patient has nothing else, no other illness, and takes no medication for anything. Type B patients are the most common. They are patients who have some disease that contributes to their infection. The most classic of all is diabetes. So we know that diabetes predisposes. Patients with diabetes have a higher chance of infection. Patients with inflammatory diseases, some rheumatisms, who take corticosteroid medication for some other things, also predispose. And then he divided it into 2 types. Patients who have a systemic disease, a disease of the whole body, like diabetes, or patients who have a localized disease that contributes to infection. A great example is patients who have vascular insufficiency. So the person has ulcers due to vascular problems and the bone is exposed, for example. So these are what they divide into patients with systemic diseases and patients with localized diseases. And there are some patients who have both together. So they call them localized systemic type B patients. And there's the last class of patients, which is type C. These patients, they have their health so severely that you can't treat them. If you treat them, they'll end up dying from the treatment. How crazy is that? So there have to be people who have such a serious illness, their health condition is so serious and they have osteomyelitis that if you treat the osteomyelitis, you end up killing the person. What an interesting thing. That's why I always say that we have to take the time to talk to the patient. We have to make a very detailed assessment to understand where our patient is. Where our patient is. Type A is easy to identify, right? Now, isn't that patient who is a type B already a type C? Where does that border lie? Oh. And if you do a treatment, you end up compromising the patient's very life. And that's where another concept comes in. This is a hook, right? Then click here and you'll be directed to our blog, the website, which talks a lot about this. When can I do a curative treatment? Or when do I do a suppressive treatment? Okay? So first of all, in order for a patient to undergo and succeed in a curative treatment, they have to endure the treatment itself. So it's a condition, the question of viability. If I can't do a curative treatment or my patient can't bear the curative treatment, which always involves surgery, I'll have to resort to suppressive treatment. So patients with type C are exclusively candidates for suppressive treatment. So I'm going to give him an antibiotic until the situation, let's say, eases, until the day God wants it to. Or a lot of the time, I don't do anything. It's a suppressive approach where I just take a wait-and-see approach. I stay with the patient, watching closely and seeing what will happen. I have to have this tact, this feeling, and I have to be close to the patient, really following up to understand where the borderline is, between the patient who can or can't handle the treatment and the patient who is going to have curative treatment or suppressive treatment, or the patient who is going to have expectant treatment as well. It's complicated. Where's the secret to this? Really following up. So I say, you who are listening, you're in doubt, right? Sometimes your doctor in your town has made a comment to you. He's saying this, he's saying that. Sometimes it's a relative of yours, a father, a mother. You have a question? Well, get in touch. Let's hear a second opinion. We can arrange a teleconsultation to understand and give you some guidance. This moment is very important. Where you are, and from that moment on, which way to go. That's what this video is for, to give you some light in relation to this situation. It's very important. I know that there are many people from all over Brazil who follow me. I've operated on people from all regions of Brazil who have seen a video like this here, who have marathoned the other videos we have here about these infection issues. And this is a video that I think helps a lot because it is, I would say, one of those primordial videos. So it gives you a guide on what to do. Did you like it? Like it, share it, show it to people who need it. Sometimes it's a relative of yours, a friend of yours. Show them, send them a link, and don't stop subscribing, because when you subscribe, you help other people who are also suffering. My name is Mário Soares, and I'd like to thank you once again for coming this far, for watching this video, and for being part of our channel. A big hug, and I'll see you in the next video.